Hi, I'm Dr. Grace, and today the question is about rectal cancer. So what is rectal cancer? It's referring to cancer that involves the last 20 centimeters of our digestive tract or gastrointestinal tract. So rectal cancer can present in a number of ways. So when patients come to see me and I suspect rectal cancer, they usually either have bleeding when they go to the toilet to pass motion. The second common symptom that they have is called tenesmus. So tenesmus is a feeling of incomplete emptying when you go to the toilet to pass motion. The third common symptom would be a change in bowel habits, meaning that if your usual bowel habits is to go to the toilet to pass motion once a day, and now suddenly you are having to go to the toilet more often, 2 or 3 times a day, or having diarrhea, or the opposite, where you're not going to the toilet as often and going only once every 2 to 3 days, or having constipation. Another symptom would be some patients come to see me with a lump or pain around the anus or the backside. So these are the common symptoms of rectal cancer. Unfortunately, there are also a group of patients who have rectal cancer, but they actually don't have symptoms. And so they're picked up at a time where they go for a colonoscopy, for example, during health screening, and we find a rectal cancer. So how is rectal cancer treated? So the treatment of rectal cancer is actually very well established. However, it can be very complicated if depending on the stage of the rectal cancer. So seeing somebody who really knows what they're doing is important. So as I mentioned, the stage of the cancer is actually the most important part about the treatment. So when a patient comes to see me with rectal cancer, or I've diagnosed a patient with rectal cancer, then the first step is always to go for staging. So staging involves usually doing a CT scan or a PET scan that helps us to determine if the rectal cancer has spread to other parts of the body. The other part of staging that is also very important is an MRI scan of the rectum or the pelvis. So the MRI scan of the rectum allows us to see how big this rectal cancer is, and also to determine if any of the lymph nodes around the rectum, and also if any of the organs around the rectum are affected. I would say that depending on the stage of the cancer, if it's early stage, then surgery first, which involves taking out the involved segment of the rectum and then doing a joining of the remaining colon is what is done. And then if the patient is advanced stage, then we would consider speaking and discussing it in a multidisciplinary tumor board meeting, where we would involve the oncologist, the medical oncologist, as well as the radiation oncologist, to discuss what is the best method going forward. Sometimes we would have to consider chemotherapy first, and sometimes we would have to consider radiotherapy first. In the intermediate group, where the patients have what we call locally advanced rectal cancer, in this group of patients, the lymph nodes are involved, or either the rectal cancer is actually very bulky. In this group of patients, we usually want to give these patients radiotherapy before attempting surgery. And radiotherapy is usually combined with chemotherapy to increase the effects of the radiotherapy. And the length of the radiotherapy is also important. Whether we give the patient what we call a short course or a long course also determines how the patient's outcome is. So it's very important that the surgeon, myself, as well as the radiation oncologist and the medical oncologist discuss the pros and cons of each approach to come up with a good plan for the patient, such that we ensure the best outcomes after the surgery and also during the whole treatment process.